According to WHO, there are 322 million people suffered from depression, and the peak age of suicide induced by depression is in young age.
Questionnaire result.
Earlier, we've already made a questionnaire for students in Indonesia, and most of them have been through a depressed moment in their life. Key element for suicide prevention strategy is a multi-sector priority that should be tailored to each country's cultural and social context, establishing best practice in an evidence-based intervention and comprehensive approach. As we know, student is a young generation of their country, and they will be the one that will build their country. A good mental health is a key to support them. But the low mental health awareness and the stigma are still be the barriers for people with mental disorders to access health services. Most people think that mental health problems are psychosocial or spiritual problems and not a medical problem. The other barrier is the limited mental health services in the general health services. Despite of a glance look indicate that they are happy and fine, deep inside the body and mind, excessive stresses beyond the recovering ability can lead to depression. Conflict in a family sometimes lead to a divorce, and it often affects the children. After graduation is the new jungle for some students. Looking for the right career for future is one of the toughest part of it. Love is part of every human life, especially in college life, but it is also a double-edged knife that can stress you out. Depression has so many faces. There are a lot of factors. Depression can lead a person to a very fatal act, suicide, death. But there's always sun after the rain, and Friends for Life is here for you.
Gadjah Mada University is pioneer of a national university with world-class and innovative excellence. Serve the interests of the nation and humanity located in Yogyakarta. It is a home for Indonesian students all across the country.
Kita semua bertumbuh dan berkembang. Dalam perkembangan, sering kita mengalami krisis yang menandakan adanya fase memasuki kematangan psikologis yang baru. Mahasiswa juga tidak pernah lepas dari fase krisis ini. Dalam mengatasi krisis ini, kita sering membutuhkan bantuan dari jasa psikologi. Mahasiswa di Universitas Gadjah Mada, Yogyakarta, bisa memanfaatkan GMC atau Gadjah Mada Medical Center yang salah satunya ada pemberian pelayanan jasa psikologi. Diskusi ini adalah dalam rangka untuk lebih memahami tentang diri dan kesehatan mental serta kesejahteraan psikologis para mahasiswa. Para mahasiswa Universitas Gadjah Mada, silahkan datang ke Gadjah Mada Medical Center untuk membantu Anda bertumbuh dan berkembang.
The physical body and mind work very closely. Mental health is an integral part of all healthcare work. So as a future physician, we would like to take as a good care of physical health of people with mental health problems and caring for a person's mental health as natural part of our daily responsibility. With Friends for Life, we do what a general physician can do and what people can do.
Friends for Life is a 2-year project that involves student empowerment in the first year with Gadjah Mada University and Community Empowerment that collaborate with Friends for Life in the second year. This project consists of creative campaign, sweet talk application, mental health week, and make friends. Caring for a person with mental health problems should be integrated into healthcare platform. To create this project, we use 5 principles that guide us into the effective care of mental health problems. It calls 5 C's. The first one is collaborative, coordinated, continuing, person-centered, and compassion.
About this project, our strengths are Gadjah Mada University has a Center for Public Mental Health, and there is annual event about mental health by Center for Public Mental Health. And we have Gadjah Mada Medical Center, and we have psychologists in each faculty.
Weaknesses that we have are: first, good socialization about mental health center in faculty, and second, limited information about events that held by Center for Public Mental Health in Gadjah Mada University, and then the third is limited time for consultation in Gadjah Mada Medical Center, and fourth, a psychologist is provided in each faculty, but only a few can have the consultation with the personnel.
We have two opportunities. First, legal aspect. The new Indonesian mental health law is sufficiently comprehensive to promote mental health services, with specific chapter on promotion, treatment, and rehabilitation. Second, facility aspect. Yogyakarta has a mental health care facility that provides promotion and prevention in community called Desa Siaga Sehat Jiwa.
Three major threats in Indonesia that affect the development of mental health facility, such as first, awareness. Indonesia still has low awareness about mental health in community. Second, stigma. Indonesia still have many stigma from community to the mental health patient. And the last is culture. Beliefs in each region and culture is different.
Creative campaign.
In this project, we will do campaign in a creative way. We will increase the tourism of depression and suicide and build partnership with stakeholders. At faculty level, we're gonna do a faculty campaign with posters and stickers that will be put in each faculty and university. We're also gonna build a commitment tree that will be an eco-friendly workplace for students and friends for life near our library. To make this campaign more organizable, we would like to make a connection with stakeholders of each faculty and affiliate them with student executive board. To make it more globally, we're gonna use social media and public figure to support our campaign, and friendly talk show with professional in radio.
Mental Health Weeks.
To raise the awareness about mental health and break the stigma, we are gonna celebrate Mental Health Week every year, October. We are gonna impress the people to break the stigma and do what makes them happy.
Make friends.
A good community empowerment should be continuing and person-centered. To make friends, we can use Sweet Talk application or train as peer counselor. With this application, someone can register as friend or someone who need a friend. In the university, we would create peer counselor for each student that need friends, and we'll do training and workshop. If needed, we're gonna refer them to seek for professional help. And in the second year, we're gonna make friends in public health center. Mobile phone is now used by most people in the world. The simplest technology is to use the phone to make calls to follow up people receiving mental health care and provide psychosocial support. An interest is making mental health care easier to deliver by enabling health workers to learn how to deliver counseling through online learning platform. With this application, people can get evidence-based information about mental health, myths and facts about depression, suicide, and mental disorders to break stigma. They can also know warning signs about depression and know how and where to seek for help. They can also write their journal about their emotions and their activity in this application. Besides that, they can connect with friends all around the world, and also they can consult with a mental professional and know about the nearest location of mental health center. Our project total budget will be $36,965.
let's talk, cause we have
Friends for life!